Open with a direct and striking statement. Reveal that hundreds of millions of people worldwide are living with prediabetes right now and have absolutely no idea. Make it clear that this is not a distant risk. It is happening silently, inside the bodies of people who feel perfectly fine. Then land the decisive question that will hold attention throughout the entire video. What if the food you eat every single day is quietly pushing you toward diabetes, and you don't even know it? From that tension, explain with clinical precision what prediabetes actually is, a condition in which blood sugar levels are already elevated beyond normal range, but have not yet crossed the threshold into type 2 diabetes. Emphasize that this is not a safe zone. It is a warning zone. But more importantly, it is a window of opportunity. A moment in which the body is still responding, still capable of reversing course, if the right decisions are made now. Invite the viewer to subscribe to the channel to receive more science-based health content regularly, and ask them to comment where they are watching from, creating a sense of real community around a shared health journey. Then shift the narrative toward the central truth of this condition. Among all the factors that influence prediabetes, nutrition is the most powerful and the most immediate lever a person has. Clarify that this goes far beyond simply cutting out sugar. What matters is understanding how the body metabolizes different foods, and how certain everyday choices are silently driving insulin resistance higher and higher. Introduce the first critical layer, what must be avoided, with the weight and clarity of a clinical warning. Refined sugars and sweets, sugary drinks and sodas, white flour in all its forms, bread, pasta, cakes, crackers, ultra-processed foods engineered for overconsumption, simple carbohydrates consumed in excess, the routine of fast food. Explain exactly what these foods do inside the body. They cause rapid spikes in blood glucose, force the pancreas to work beyond its capacity, and, over time, deepen insulin resistance, accelerating the path toward full diabetes. Then make the turn. Move with authority into the solution, the foods that work in favor of the body's metabolic health, foods rich in fiber, vegetables, legumes, oats, which slow glucose absorption and protect the gut. Lean proteins such as eggs, fish, and chicken, which support satiety and muscle without raising blood sugar. Healthy fats from avocado, olive oil, and nuts, which reduce inflammation and improve hormonal signaling. Low glycemic index foods that keep glucose stable throughout the day, whole grains that replace their refined counterparts, and water. Proper hydration as a non-negotiable foundation of metabolic function. Explain that these foods work together to stabilize blood sugar levels, restore insulin sensitivity, and provide steady, consistent energy, instead of the spikes and crashes that worn-down metabolic systems produce. Connect this directly to the viewer's daily life. Show that these are not extraordinary changes requiring medical facilities or expensive interventions. They are consistent, informed choices made at every meal. And in many documented cases, those consistent choices are enough to fully reverse prediabetes. Make it clear this is not a temporary diet. This is a new standard of living, one that the body will respond to and reward. Close by delivering the solution with full clarity, control over prediabetes is directly tied to daily food choices. Knowing what to avoid and what to prioritize can stop the progression toward type 2 diabetes entirely, and protect vital organs including the heart, kidneys, and brain from long-term damage. End with a powerful and memorable statement: prediabetes is not a sentence, it is a warning, and those who understand that warning in time have the full power to change their health future.